All around us, whether it's a neighbor across the street, a cousin you haven't heard from in months, or even someone sitting quietly in the next room, there is someone carrying the heavy weight of financial worry. Maybe it isn't you, but it is almost certainly someone in your circle. People are stressed not because they've done anything wrong, but because navigating Social Security, retirement benefits, disability payments, Medicare, Medicaid, SNAP, and all the other programs feels overwhelming, confusing, and sometimes impossible. And with prices rising faster than incomes, seniors in America, especially those living almost entirely on Social Security, are feeling the strain more than ever. Many of them wake up wondering how they will stretch groceries, medications, and basic bills to last until the next month. That's why understanding what benefits exist and making sure every eligible dollar reaches the people who need it is more important now than ever. Before we go any further, I want to welcome you to Truth Lens, my channel dedicated to cutting through the fog of complicated government systems. Here, we break down the bureaucracy in plain language, shine a light on benefits so many people don't even know they qualify for, and create a space where seniors, low-income families, and everyday Americans can finally understand the programs they paid into for decades. At Truth Lens, our mission is simple: to give people clarity, dignity, and real answers in a world that often feels designed to confuse them. If you're new, welcome to a community built on compassion, truth, and service. Every day, people come to channels like this because they are tired, confused, and exhausted by the maze of acronyms and rules attached to Social Security and Medicare. Our inbox is full of seniors saying they've worked their entire lives, paid into the system faithfully, and now, when they finally need help, they can't understand what they're entitled to. Many tell stories about skipping meals so they can afford prescription drugs, or giving up doctor visits because they fear another medical bill will break them. And these are the very people who poured decades of labor, sweat, and taxes into this system. It's painful and unfair, but it's also why spreading this information matters. So let's walk through everything, clearly, calmly, and from the perspective of someone who spent years working inside the Social Security system and understands how this all operates behind the scenes. To start, Social Security is not just retirement checks and Medicare cards. It is an enormous network of programs built over decades, filled with rules, sub-rules, and exceptions layered on top of exceptions. There are over 20,000 pages of Social Security policy alone, enough to confuse even seasoned employees. So today, consider this your insider's overview, simplified into language anyone can understand. Let's begin with the most common type of benefit: retirement benefits. Many people file incorrectly because they rush or don't understand the consequences of timing. Early retirement starts at age 62, but it comes with a reduction. Filing before your full retirement age permanently lowers your monthly check. On the other hand, waiting past full retirement age earns you delayed retirement credits, 8% more per year up to age 70. For many seniors already struggling to survive on limited income, that extra delay can mean hundreds more dollars each month. But for others who cannot wait because the cost of living is suffocating them, early filing becomes the only realistic choice. These are the difficult decisions millions of seniors face. Then there are earnings limits, rules that punish people who try to work and claim benefits early. If you're under your full retirement age and earn above the annual limit, Social Security takes back $1 for every $2 you go over. For seniors who are already scraping by, this rule alone can determine whether they risk working a few extra hours or decide it's safer to live with less. And in a time when groceries, rent, and prescription drugs feel like luxury items, the thought of living with less is terrifying. Now, Medicare. This part confuses nearly everyone, and with good reason. There's Medicare Part A for hospital care, Part B for outpatient and doctor services, Part C for Medicare Advantage plans, and Part D for prescription drugs. There are supplemental Medigap plans like F, G, and N. There are enrollment periods stacked on top of enrollment periods: the initial period, the special period, the annual period, and the general period. You miss one of these windows, and the penalties follow you for life. Imagine being 72 years old, living on nothing but Social Security, and realizing one missed deadline means paying higher premiums forever. Seniors tell us these stories constantly, and it breaks your heart every time. Many seniors also don't know they might qualify for Medicare savings programs through Medicaid, which can pay their Part B premium, a premium that climbs every year. For someone living on $1,100 or $1,300 a month, not having to pay that $170 to $200 monthly. Part B premium can mean the difference between having food in the refrigerator or going to bed hungry. It can mean the difference between taking a medication or skipping it because the cost is too high. These programs exist for a reason, but millions of eligible people never apply because they simply don't know. Medicaid itself is another piece of the puzzle. It varies by state, has different names across the country, and was recently hit with massive federal cuts. Seniors who rely on Medicaid for long-term care or medical assistance are already reporting reduced coverage, fewer services, and more aggressive removal from programs. Seniors living alone, especially widows and widowers who depend on Medicaid to survive, are some of the most vulnerable. When benefits are reduced, they suffer first, and often they suffer silently. Then we move into disability benefits, which come in several forms: SSDI, SSI, disabled widow benefits, disabled adult child benefits, and more. SSDI is based on work history. SSI is welfare-based and pays only up to $994 a month in 2026, an amount that cannot cover rent in most places in America, let alone food, utilities, and medical needs. Seniors transitioning from disability to retirement often don't know that their benefits change. Others fear returning to work because they worry one mistake will cut off their income. The rules for working while disabled, trial work periods, SGA limits, extended eligibility are overwhelming. Many seniors become trapped, not because they're unwilling to work, but because the rules feel like a minefield. Then there are spousal, divorced spousal, and survivor benefits, programs where millions of dollars go unclaimed each year simply because people don't know these benefits exist. Widows and widowers often discover years later that they missed thousands in survivor payments. Divorced spouses who were married 10 years or more are often eligible for benefits on their ex-spouse's record, but many never apply. And for seniors living alone, barely surviving on their own small check, that additional benefit could have changed everything: paid for heating, medications, even prevented eviction. There are child in care benefits, parents' benefits, and even benefits for grandchildren living with grandparents, programs many families never hear about. And when a loved one passes, Social Security offers a lump sum death payment of only $255, an amount that has never been adjusted for inflation and stands today as a symbol of how outdated and insufficient many of these systems have become. And on top of all this, we have SNAP, food stamps, overpayments, appeals, and endless reviews. Seniors who already struggle to live on small Social Security checks often find themselves fighting the government just to keep the benefits they already earned. Many are tired, overwhelmed, and afraid. They shouldn't have to battle bureaucracy after spending decades contributing to this country. Yet this is the reality millions of seniors face right now. And it's why communities like ours matter. Because when people share these videos, when they comment, when they help spread this information, someone out there, some grandmother living alone, some disabled senior struggling to pay for insulin, some widower who didn't know survivor benefits existed, may receive the support they desperately need. This is the reason Truth Lens exists, to make sure no one falls through the cracks of a system they spent their entire lives paying into.